The results can come back within minutes. It could tell us whether or not we've been infected with COVID-19.
Right now, for the antibody test, it's in high demand. So I can tell you, today we actually had to close a little early. We got a little overwhelmed.
Lincoln Urgent Care uses a finger stick for testing. Results are in within 10 minutes.
There's two different antibodies we're testing for. Right now, the test kits we have combine the two. So you get an IgM, which is something you get more early in the infection, and then you get IgG, which is what you get when a person has had the infection and then has now more of a immune response later on.
Urgent Care Now in Arden Arcade and Fair Oaks also offer antibody testing, but the blood is drawn into a tube and you get the results in 1 to 3 days. Health expert Dr. Payal Kohli describes the antibody test as a snapshot of the past, but we have to be cautious of the results.
I think it's really important to know that just because you have the antibodies against the virus, that doesn't necessarily mean that you're immune to the virus.
There are several antibody tests out there on the market. The FDA granted an emergency use authorization to get more people tested, but Dr. Kohli says that may have compromised some of the quality. Normally, if a test is approved for use in the country, it goes through a rigorous process from the FDA. Data shows rapid tests may not be as accurate as blood-drawn tests.
The range of testing is variable, so there's some tests that are wrong about 8% of the time, and then I have seen there are other tests on the market out there that can be wrong 30 to 50% of the time.
However, the tests, if accurate, can be beneficial. It can help someone else through plasma treatment and help scientists pinpoint what the virus is doing and predict its behavior. If you're planning on getting tested, make sure to wait 7 to 10 days after your symptoms have resolved to make sure there are enough antibodies in the system to detect.
So if you had symptoms in December or January and you are wondering whether or not you may have had COVID, it's not too late for you to get the antibody test.
If you want to get tested, check with the location first. The urgent cares we mentioned don't offer appointments and are walk-ins. The cost depends on if you have insurance, but can run between $100 to $200, including the visit fee.